My name is Marianne Dalzell, and I am a clinical specialist in oncology for the past 15 years and have been past clinical director of the Rehabilitation and Exercise Oncology program at Hope and Cope in Montreal. The question that I'd like to address is whether or not all cancer patients have to be concerned about their bone health. And the answer to that question is no. The risk to bone health is quite specific. And in that, it's the cancers that, some cancers metastasize to bone commonly. It's the common route would be from their original tumors. Some of the cancers will metastasize to bone. And those types of cancers are lung cancer, breast cancer, prostate cancer, thyroid cancer, and multiple myeloma. So there are very specific cancers, again, that would more likely metastasize to bone. But then there's the other issue, and that is that some cancers, due to the treatment that is being given for their cancer, are at greater risk, their bone health is at greater risk because of the actual treatment itself. Now this becomes more multidimensional, and by that I mean it's not one cause that will contribute to a deterioration of bone. It is rather multiple factors that contribute to that bone potentially deteriorating. One of the biggest factors is chemotherapy and the type of chemotherapy that you are receiving. So that not all chemotherapies are associated with some loss of bone health or bone mineralization, don't change the environment of the bone whatsoever, whereas others have been known and have been shown to denurture the bone. And so these are of greater concern. And the types of cancer, once again, that have been shown, or the types of chemotherapy that have been shown to denurture bone, are those that are used for breast cancer, prostate cancer, ovarian cancer, and many of the hormone-sensitive cancers. Going forward, if a person has had an early stage cancer of any sort and is not receiving chemotherapy, only receives surgery or radiotherapy, or a combination even of surgery and radiotherapy, these same patients are not at greater risk for their bone health. It really is other elements, and that is the chemotherapy element. It's whether or not you receive corticosteroids in order to control nausea, in order to control loss of appetite. These corticosteroids will also have an effect on bone. It's your level of activity throughout the treatment process, which in itself will very much affect the health of your bone. So that if at the time of diagnosis you decide to hibernate and not move as a result of the fact that you're hoping to preserve your energies, it is precisely the opposite that you should be doing, in that your form follows function always, and your bones will not be as healthy if you stop your activity levels. In summary, not all cancer patients are at risk, or their bones are not all at risk. It is only select populations. Patients who have an early stage cancer are not at greater risk for a deterioration of their bones, particularly if they never receive chemotherapy, hormone blocking therapies, or radiotherapy. It's only those patients who do receive chemotherapy of a certain type, associated with certain types of cancer, who may be at greater risk. And the second population of patients that would be at greater risk for their bone health are those who have a more advanced cancer, and those advanced cancers may be associated with bone metastasis. And those cancers, again, are lung cancer, breast cancer, thyroid cancer, melanoma, and multiple myeloma.